Well, about a third of Americans report experiencing some kind of knee pain, and according to the CDC, it is the second most common form of pain that is experienced. Dr. Richard Busch of Busch Chiropractic joins us now. And Dr. Busch, tell us a little bit about, first of all, what type of knee pain are you talking about here?
Well, there are all kinds of different knee pain, whether it's sports-related types of injuries or just, the weekend warrior types of injuries that we all get while cleaning up the leaves or something like that in the yard. And these can deal with any of those types, or even the degenerative changes that take place over the course of years of improper movement and that chronic knee pain that people develop over time.
So it is so very, very common. What can be done about it?
Well, the interesting thing about it, if we look at the knee, first of all, the way that the knee is put together is, it's kind of it's stable, but it's not as stable. And in a lot of cases, the way that it moves and it kind of twists back to as we're straightening our knee out, there can be some catches in there. And so, some of the different things that we might see are things like clicking or popping or even swelling around the knee. Those types of things are indications that we have some type of a problem. Obviously, pain when we're stepping or twisting, or pain when we push on it. But as far as that type of thing, we can see any type of an injury from just a minor little muscle, or a ligament strain, to a tear, whether it's on I'm sure that you probably have heard about a medial meniscal tear or a lateral meniscal tear. But then along with that, even some of the ligaments, whether they're on the inside of the knee or the outside, and then also along with that, like the anterior and posterior cruciate ligaments that help things keep from sliding back and forth.
So how do you treat it?
Well, there are a lot of different things that we can do. Medically speaking, for years, obviously we've done things like exercise, just rest and ice. But then along with that, some of the more advanced forms of treatment for that are things like cortisone or steroid injections or surgery. Okay, those are pretty common. But we want to avoid those things because a lot of them have other problems later on. And so what we're working to do is we're working to use things like different types of laser treatments, but also specific types of ultrasound that will actually break up scar tissue and adhesions. It's not like the ultrasound that they use to view babies, or the type of thing that you may have used back in the past to help with some inflammation in your knee. This is the type of thing to break that stuff up and actually cause your body to begin the healing process. That through some other things as far as exercise, and even some other treatments that we're just beginning in my office that have an extremely effective and successful success rate. We're helping those people avoid not only surgeries, but live with chronic pain.
Yeah, and you don't want to just grin and bear it, because it's not going to just go away if there's something
No,
like
it's
that.
absolutely horrible. And you can't, it limits your ability, it limits your quality of life.
Right, absolutely. All right, Dr. Busch, appreciate you so much
Thanks, sir.
for coming
Appreciate you
in.
as well.
You can find out more about Busch Chiropractic. Just call the number right there on your screen.